A flat, well-toned abdomen is something many of us try to achieve through good eating and exercise habits. Regardless of effort, however, even people of normal weight and proportions may develop a protruding abdomen with sagging skin that hangs over or below the waistline. Common causes of this condition are pregnancy, heredity, and significant fluctuations in weight. If your loose skin and protruding abdomen don't respond to exercise and proper eating, a tummy tuck may be the solution. A tummy tuck is a cosmetic procedure that can restore a firmer, flatter appearance to the abdomen and improve the presence of sagging skin, reshaping your body contours and enhancing your self-image. It can also correct a condition called diastasis, where the muscles of the abdomen have become separated. This presentation will give you a general overview of abdominoplasty, or tummy tuck procedure. It is not a substitute for a complete consultation with a qualified surgeon. A complete consultation will include the discussion of your goals and expectations for the procedure, an evaluation of your specific situation, a recommended course of treatment, and a discussion of potential risks and complications. Any questions and concerns should be addressed during the consultation. Full disclosure of your health history is important to your safety. This includes any history of medical conditions or illnesses in your family, your current use of any medications, vitamins, herbal supplements, as well as any alcohol, tobacco, or drug use. Good candidates for abdominoplasty are healthy men and women with no life-threatening illnesses. You should be close to your ideal weight with good eating and exercise habits. Pregnancy or other fluctuations in weight, whether losing or gaining, can adversely affect the results of the procedure. A positive outlook and reasonable expectations are also important. Patients who smoke are at increased risk of poor healing. They are advised to stop smoking for several weeks before and after surgery. Certain conditions may preclude you from or require special precautions during the procedures. These conditions include cardiovascular disease, high blood pressure, certain circulatory disorders, and diabetes. Prior to your procedure, you will be asked to sign informed consent documents. These are used to make sure you fully understand the procedure, including any risks and complications, and that you commit to following any and all instructions you are given. These include pre-surgical considerations, day of surgery instructions, and information relating to the use of anesthesia. Liposuction may be recommended in conjunction to abdominoplasty to reduce excess fat and reshape the love handles and waistline. In cases where excess fat is the only factor and skin tone is good, liposuction may be recommended as an alternative to abdominoplasty. Other procedures may also be performed in conjunction with abdominoplasty. Multiple procedures will increase the length and complexity of surgery, as well as the risk of complications. This should be discussed carefully with your surgeon. Abdominoplasty is a surgical procedure that requires a horizontal incision between the navel and the pubic bone. The length of the incision is determined by the amount of skin that needs to be removed in order to achieve your goals. This can mean extending only a few inches, or from hip to hip, or even longer. A second incision may be necessary around the navel to correct for excess skin in the upper abdomen. Abdominal muscles may be repaired through this incision if necessary. Through these incisions, your surgeon will remove excess fat using surgical techniques and lipoplasty. Underlying tissue is reshaped and reduced, and excess skin and tissue will be removed. The skin will be redraped over new contours, and excess skin will be removed. Following the procedure, sutures, skin adhesives, tapes, or clips will be used to close the incisions. Small thin tubes may be placed in or near the incisions to drain any excess fluid that accumulates. Elastic bandages or a compression garment may be worn for a few weeks to reduce swelling, provide support, and help the skin conform to your new body contours. Following the procedure, you may find it difficult or painful to stand up straight or to lie flat. You may be instructed to maintain a somewhat bent position and sleep with pillows elevating your knees. You should begin light walking within a few days of your procedure. This should happen every few hours during recovery. Bruising, swelling, soreness, and numbness are all common side effects with body contouring procedures. Skin may also feel more firm than normal. Any discomfort or pain you feel can be controlled with medication. As with any surgery, possible complications may arise. These include infection at the surgical site, pigment irregularities, skin or nerve damage, uneven contours, fat clots and blood clots, fluid loss or accumulation, and poor healing at the incision site. The use of anesthesia in any procedure presents its own risks. Any sutures or clips will be removed after 5 to 10 days once initial healing has taken place. Healing will continue over the next few weeks or months as swelling continues to resolve and your new contours take shape. It is important for you to keep active during this time, but refrain from any heavy lifting, bending, pushing, or strenuous activity until your surgeon gives you clearance. Although they may be obscured by swelling and bruising, your new smoother, tighter contours will be immediately apparent. Your skin quality, both in appearance and feel, will be dramatically improved. Incision lines are permanent, but may be concealed by many styles of undergarments. The results of abdominoplasty are generally permanent. Maintenance is achieved through good eating habits and regular exercise. Once you have recovered from one stage of procedures, it may be time to prepare for additional procedures targeting other areas of the body. Proper and diligent sun protection must be maintained to help prevent pigment irregularities. Abdominoplasty will help you reach your goals, give you the satisfaction of attaining the new contours you want, and bring peace of mind in having the body you desire.